Okay. My name is Lauren Stanley, and today I'm going to be showing you guys how to do an intramuscular Z-track method. So before we begin, I'm just going to go ahead and check my order. My order is for vitamin K, 1 milligram per 1 milliliter dose. It's a one-time dose. So I'm just going to go ahead and check the MAR before I enter the medication room. I'm checking for the right patient, the right drug, the right dose, the right route, and the right time. So after I've checked the MAR, I'm going to go ahead and enter the medication room. So today I'm going to be administering vitamin K. It is already reconstituted. I did that earlier. So now that I have that, I'm going to be using a 1 milliliter syringe, and I have my 2 different needles right here. So before I begin, I'm going to go ahead and perform hand hygiene, and I'm going to put on my gloves. So now that I have on my gloves, I am going to get an alcohol pad. I'm just going to wipe the top of the vial. And while that is drying, I'm going to go ahead and open up my syringe and pull that out. And I'm going to get my needle, and I'm going to put that on. Okay, so now that that is on, I'm going to pull the cap off. I'm going to go ahead and draw out 1 milliliter. And I'm going to make sure that that's correct and get it at eye level. And then I am going to inject the air into the syringe. Okay. Now I'm going to pull it out. And I am going to go ahead and get the bubbles out and make sure that this is exactly 1 milliliter. Okay, so now I am going to go ahead and I'm going to cap the needle. And I'm going to take this needle off. And if this were a clinical setting, I would go ahead and discard this in the sharps container, but for demonstration purposes, I'm going to set this to the side. And I'm going to go ahead and get my 1/2 inch needle, and I'm going to go ahead and put that on and make sure that it is capped. Okay, so now I'm going to discard of these gloves. And I'm going to go ahead and go to the patient's room. I'm just going to check the MAR once again for the 5 rights and make sure that my medication is correct and everything. So now that I'm in the patient's room, I'm just going to go ahead and perform hand hygiene. I'm going to put on a new pair of gloves. Okay, so after that's done, I'm just going to go ahead and assess the skin. I'm going to make sure that there's no rashes, breaks in the skin, bruises, anything like that. So now I'm just going to go ahead and get an alcohol pad, and I'm going to wipe the skin from the innermost part to the outermost part. I'm just going to go ahead and discard of that. And while my skin is drying, I'm just going to go ahead and check the medication again, make sure that it is the right medication, check the MAR, make sure everything is correct. So now that I know it is correct, I'm just going to go ahead and uncap my needle. And so for this method, I'm going to go ahead and displace the skin like this. I will be injecting at a 90-degree angle, so I'm just going to go ahead and go in. I'm going to hold it there for a few seconds. I'm going to go ahead and pull that out. Okay. And at this point, I would put the safety cap on the needle in a clinical setting, but since I'm not in a clinical setting, I'm just gonna go ahead and cap it like this. And I'm gonna discard this in the sharps container. So now that I'm done, I'm just gonna go ahead and assess the skin one more time, make sure that there are no adverse reactions. If it's bleeding, I'll go ahead and put a cotton ball on it just to make sure to stop that bleeding. But if it's bleeding excessively, I'll just go ahead and hold the cotton ball in there and bandage it with a Band-Aid. And after that, I'm just gonna check for any side effects or anything. And that is how you do an iron injection for a Z-Track method.